Hey, what's up everybody? Dr. Ryan Weaver here with Apex Spinal Performance. Today's wellness workshop, we're going to be diving into some basic stretches. A lot of these stretches we share with our patients when they begin care. We advance those throughout their care plans and throughout their growth in posture health and spinal health. So some of the ones I'm going to go over with you, these are very simple to do. You don't need any equipment. We kind of call these like level 1, step 1, entry level, if you will. These are also easy ones that you can do at your desk. A lot of these. You hear us talk about desk job ergonomics. These are little things that you can do. Some of them you can't because you're going to have to use a table or a floor or your couch or even your bed. So again, before we get into this any more, like, subscribe our YouTube channel, our Facebook channel. That way you can get all these up-to-date information on spinal workshops, wellness workshops, anything else going around in our office here. So let's dive into this. So the first one that you can do, I always talk about cervical extension a lot because within our community, within really our society, especially as Americans, 75% of our occupation and our jobs, we sit at a desk. So inadvertently, that puts us in a lot of rounded shoulders, forward head posture. So the first one I'm going to go over is just cervical extension. It is legitimately this easy. From this front view, all you're going to be doing is basically just kind of letting the weight of your head take you back up towards the ceiling. From a side view, now again, notice I'm not forcing anything back there. Some of you may be really restricted to start with, but that's just helping bring that cervical spine into extension, because unless you're walking around looking at the sun, birds, or the moon or anything, you're usually not looking up too often. You can also do that seated, so cervical extension. I'm not really going to get into sets and reps here. Just doing that throughout the day will help kind of break that up. And if you are a student and maybe you study a lot, you'll kind of inadvertently want to just randomly look up anyway, and that's your body basically saying, hey, we need to get out of a flexion and go back the other way. So the next one we're going to do is what we call lateral neck bend. Very simple one here. You can do the same position, standing or seated, and you're basically just going to take your ear to your shoulder as far as you can. Now, I'm not really forcing anything right there. That is just natural movement for me. One of the things I often tell our patients, just use the weight of your arm or your hand. When you get here, just kind of rest that on the side. You can pull a little tension, might feel a little burn on the opposite side, but notice I'm not overly bending. I'm also not bending from the thoracic spine as well. I'm just trying to isolate just your cervical spine. You can do that both sides. Again, from a side view, just go as far as you can and apply a little bit of pressure, and there. Our next one is a little bit of a variation here of that. I call this a 45-degree stretch. This one I personally like to perform in a seated position. So I always say just take your nose to your opposite knee. So you're going to bend 45 degrees from front to side. You're going to try to take your nose down through there. So you're going to feel a little bit of that lateral neck bend stretch, but you're also going to feel some of the musculature from the back of your neck into your shoulder blade. You can go the other way and back there. Same thing here. You can bring your hand up and you can slightly pull that down. So again, those will help break up some of that forward head posture, help stretch back through here the muscles that get overactivated. One of the other ones that we're going to do here, so I've never went over this one before. It's kind of a stretch, it's kind of a muscle activation, if you will. I call this a shoulder blade squeeze. So basically from a front view, I'll kind of show you this in 3 different planes here, but from front to back view, you're just going to try to pull your shoulder blades as far back as you can. One of the things I tell our patients, if you can put a pencil between your shoulder blades and try to squeeze those together so it holds it there and really pinch those shoulder blades together. So from the side view, you can just put your hands here and you're going to think of bringing your elbows and your shoulder blades back. From a back view, you're just going to squeeze that back and just hold there. So that's one I would say to do every so often. You're going to probably get better at that each time because the muscles are going to be more activated. Again, this is the normal American when we want to bring that shoulder blade and the front of the shoulders back. So the next one we're going to move to, wall angel. You can also do this laying on the ground. This will help with that rounded shoulder again. You can put your heels, the back of your glutes, the back of your shoulders, back of your head against the wall. Think of almost making like a touchdown sign, and you're going to bring your arms back. Okay, my goal there is the elbows and the wrists back, and you're going to try to bring up your thumbs together and try to keep the back of your arm up against there. Now, things you'll notice with not being flexible and having restricted range of motion. A few things. When I bring up here, you'll see a lot of people bring their hips forward, depending again where they're tight. So you could cheat that a little bit and bring your feet out from that. It's going to relax your back a little bit more, and then you can perform the same movement. I always say slow and controlled. Pass through that a few times. Again, you can do that laying on your back as well. That's also going to allow gravity to kind of help pull your arms back. Again, just starting out, you may only be able to get to here, but again, we want to work on some of that, what's called external rotation of the shoulder there. So, excuse me, our next few, I would say to you do this on a floor, a hard surface for support. So activating some of our lower back and our glutes and stretching out here. The first one we're going to do, I call this a glute bridge. So you're going to basically place your heels like so, feet flat on the floor. And what you're going to do, this is going to activate a lot of your glutes here, is you're going to think of taking your stomach, your hips up towards the ceiling. You're going to squeeze your glutes all the way up, hold, and you're going to come back down. Okay? You can do that with both legs. If you want to get fancy and you have the ability, you can do it with one leg, and you can do it with the other leg. So that one's called a glute bridge. Again, some of these are just muscle activation to help break up that stagnant lifestyle or sedentary lifestyle that we live, or again in a desk job setting. The next stretch, if you've tuned in any of our spinal exercises before, we've went over this one. We go over this one a ton. This is our knee to chest stretch. So again, you're just going to be laying flat on the floor, and you're going to pull that knee to your chest as far as you can. You're going to pull that a little further. Again, as much as you can. If you are not very flexible, okay, and maybe you can only get to here, you can also take like a yoga rope or band or even a towel and help pull that knee as far as you can. I often switch back and forth. That's just me. If you say you did 5 or 10 sets per leg, you could stay on one leg. Again, there's no, to me, rhyme or reason of doing one more than the other or alternating back and forth. The last one that we're going to go over today, cat-cow. You probably heard of this one before. Very common stretch here. So you're going to place your knees under your hip, your hands underneath your shoulders. And for the cat, you're going to think of a string basically being in the middle of your back, pulling you to the ceiling, where you just try to hike up your mid-back and your shoulder blades. Head's going to be down. And then for cow, you're going to go the opposite. So you're going to kind of let your stomach, your abdomen sink towards the ground, and you're going to also look up in extension and back and forth. So especially for your thoracic spine, you're going to really like that one. It's going to help stretch out, again, those shoulder blades, the thoracic spine, your rib cage as well. So these are just 8 stretches that you can do on a daily basis. I think adding that into a daily routine, exercise routine, will help activate some of your muscles, get some blood going, get your heart rate up. But these are all little things that you can do that take minimal amounts of time to just make you healthier one day at a time. So thanks again. Again, like, subscribe, tune in for next week's spinal workshop, and we'll look forward to seeing you then. Thanks. Hey everybody, hope you enjoyed that spinal workshop. Don't forget to like the video if you learned something, and be sure to share it with somebody else who may benefit from that information discussed. Also, make sure you subscribe to our channel and click the notification bell so you are alerted whenever we post a video.